If you are on a birth control medication and you are experiencing hair thinning or hair loss, look no further. It is likely that we both know who the culprit could be. Just like other drugs, hormonal birth control methods have side effects. One of them is the thinning and loss of hair. This might even continue after the person has stopped using birth control. Birth control, as the name implies, are measures taken to prevent conception or to balance hormones in the body. This video will talk about the birth control methods, how they function, how they cause hair loss, and what you can do if it is experienced. What are the types of birth control methods available? There are two broad types of birth control methods. They are the hormonal and non-hormonal birth control methods. Non-hormonal birth control methods do not have hormones in them. They are quite effective if used properly. The non-hormonal methods are condoms, diaphragm, birth control sponge, copper IUD, and cervical cap. Hormonal birth control methods contain progestin and estrogen. Some contain only progestin. They are dependable and safe. These methods are birth control pills, injections, skin patches, vaginal rings, and implants. How do hormonal birth control function? Hormonal contraceptives contain little quantity of hormones that perform different functions to prevent pregnancy. These functions are: 1. Prevention of the production of hormones that bring about ovulation. 2. Thickening of the cervical mucus to prevent the movement of sperm to the egg. 3. Thinning the wall of the womb, making it difficult for a fertilized egg to implant. How does hormonal birth control methods cause hair loss? Hormonal birth control methods such as the pill or the implant can cause significant loss of hair. It is more noticeable in women that are hormone sensitive or are genetically susceptible to hormone-induced loss of hair. Hair growths occur in cycles. The cycles of hair growth are the anagen, catagen, and the telogen phase. The anagen phase is the period when active hair growth occurs. The hair grows out from the follicle in this phase and it can last up to 7 years. The catagen phase is the phase when the hair growth process becomes transitional. The rate of hair growth slows down drastically or stops entirely at this stage. This lasts for 20 to 25 days. The telogen phase is a period of rest for the hair. There is no occurrence of hair growth at this phase. Hair loss occurs but minimally. You could lose about 100 strands of hair daily at this phase. This phase lasts for about 90 days. Hormonal birth control can quickly move the hair growth phase from the catagen phase to the telogen phase. This is regarded to as telogen effluvium. You could lose a large quantity of hair, especially if there is a history of baldness in your family. This could also happen if there is a swap from a type of hormonal birth control to another. How can you treat hair loss from birth control? 1. Minoxidil. This is a topical medication, sold over the counter as Rogaine. You can apply it to your scalp to induce hair growth. Both men and women can use it to combat hair loss. It stimulates the hair follicle to grow hair more and for longer. It also lengthens the anagen phase of hair growth, leading to thicker hair and the reduction of bald patches. Rogaine is sold in 2 different concentrations depending on the intended results. The 2% concentrated solution is to be applied twice daily. The 5% concentration solution is to be applied once daily. The 2% concentration solution is effective in the treatment of female pattern baldness, also known as androgenetic alopecia. It is advised that Rogaine should be used continuously even when hair regrowth occurs. Hair that grows from the effects of minoxidil tends to fall off after 5 to 6 months of discontinued use. Applying Rogaine on the neck, ears, and face could lead to hair growth in these areas. There might be cases of hair loss during the first 2 to 3 months of use. This stops as soon as the growing hair becomes fuller and stronger. The side effects of minoxidil are mild and uncommon. The most reported cases are skin allergies and irritation due to the alcohol present in the medication. Changing from one Rogaine brand to another could also make the irritations more pronounced. 2. Hormone therapy. Women with hormonal imbalance produce androgens and it leads to rapid hair loss. Introduction of an anti-androgen such as spironolactone or hormone replacement therapy can be done. Hormone replacement therapy varies and depends on the hormone causing the hair loss. When the hormone level returns to normal, hair loss could be drastically reduced. You can do this in combination with other hair growth regimes such as medications, scalp massages, and change in diet. It is always important to seek the help of a doctor before undergoing hormone therapy since it could cause a lot of discomforting side effects. 3. Ketoconazole Shampoo. This is an antifungal shampoo used to treat hair loss that occurs in patches due to inflammation of the hair follicles. It is also known to improve the texture, color, and strength of the hair. You can find it under the trade name of Nizoral, made with a low dose of ketoconazole. Higher concentration can be used after seeking proper medical advice. 4. Corticosteroids. They are steroids and are used to treat hair loss. It could be used as a topical, injections, or tablet depending on the severity of the hair loss and the site. Injections are used for very severe cases. Topicals are suitable for localized areas such as the eyebrows. Corticosteroids help in reducing the inflammation at the hair loss areas. It also suppresses the immune system in situations where the hair is caused by autoimmune conditions. Some hair care products may contain corticosteroids in minimal quantities. However, steroids such as betamethasone butyrate and hydrocortisone can be used to manage hair loss. But they must be prescribed by a doctor before use. 5. Plasma injections. Injections of blood plasma that hold a reasonable number of platelets can be used to reduce the loss of hair. A specialized doctor conducts this. Blood is collected and separated. Plasma and platelets will be taken and injected into the affected parts of the scalp. These injections speed up the repair of the scalp tissues and prevent further hair loss. It boosts the density and diameter of your hair. 6. Hair transplant. Hair transplant is done by taking hair from a part of the scalp that is thicker and placing it on the thinning or bald section of the scalp. Hair is usually taken from the back of the head to an area where there is little or no hair. Hair can also be taken from other parts of the scalp. The area that the hair will be taken from is sterilized and numbed with an anesthetic. There are two methods that can be used to transplant hair. They are the follicular unit strip surgery and follicular unit extraction. In follicular unit strip surgery, a piece of the scalp is removed from the back of the head and closed with stitches. The removed scalp is separated into small fragments known as grafts which can contain 1 to 5 strands of hair each. Holes are made on the bald areas and the graft is inserted into these holes and covered with bandages. In follicular unit extraction, hair is shaved from the back of the head and the hair follicles are taken out of the scalp. Holes are made on the bald area and the hair follicles are fixed into the holes. It is then covered with a bandage. 7. Scalp massage. This is like the normal body massage, but you can do this a bit more gently and without oil. Do this with your fingertips or massaging device which mimics the fingertips. The scalp massage affects the hair follicles and stretches its cells. This increases the thickness of the hair growing from these cells. The massage also dilates the blood vessels that supply blood to the hair follicles, which helps the hair to grow longer. If you found this video helpful, click the subscribe button below. Turn the notification on, so you'll know once we post a new video. Do not forget to visit our site www.zimhairlosshelp.com for more awesome hair care content like this.